The use of the GTH analysis software requires the entering of information about your health and the health of your relatives. The more information you have available, the better the risk analysis will be. It is worthwhile to get information such as laboratory values from your healthcare provider and information about your relatives, such as date of birth, dates of onset of diseases like diabetes, heart disease, cholesterol problems, hypertension, and others, prior to beginning the data entry. The following video will walk you through the data entry process. This process is based upon the approach that members of the family are identified and accessed through symbols on a pedigree, which is a graphical representation of a family. Step 1 is your registration, where you enter your first name. In this example, we are using Tim, your year of birth, your gender, and your agreement to the terms and conditions. Step 2 is to click on your symbol in the pedigree template, which takes you to the lifestyle data entry page. Step 3 asks you to enter the data on the lifestyle data entry page, such as your weight, height, waist circumference, and whether you smoke or use cocaine or steroids. Step 4 asks you to enter your data on the first of 3 health questionnaire pages, where you are asked if you have diabetes, hypertension, and whether you are taking medications. Step 5 asks you to enter data on the second and third of the health pages, where you are asked about abnormal cholesterol, triglycerides, and other tests. As you can see, you are also asked for the laboratory values for these tests. You have now completed the data entry for yourself. Step 6 is the beginning of the extension of the pedigree to include your family members and gives you the opportunity to enter their demographic, lifestyle, and health data. First, you click on the symbol of your father and follow with entering his name, year of birth, and if deceased, the year of death. Step 7 is the lifestyle and health data entry pages for your father. The same data entry pages for each of your relatives asks about whether they have had a heart attack, stroke, peripheral vascular disease, or heart surgery, along with the ages of occurrence of these. It also asks whether they are overweight, questions about smoking, and so on. As you can see, each topic has an icon with the letter I on it, which when clicked gives help information regarding that question. In Step 8, you are asked whether your father has any children other than you. As you can see, you are already listed. This gives you the opportunity to click the Add a Child button for a full sibling of yours, or the Children with Other Partners tab for adding half-siblings of yours with the same father but different mother. Step 9 is the data entry pages for the child that has just been added. Don't forget the Save button at the end of the pages. As we now turn back to the pedigree, you can see that your father, Steve, and your sister, Helen, have been added. You then follow the same process with your mother, both sets of grandparents, and your children in order to complete the pedigree as seen here. The completed pedigree is one of the 3 parts of the output generated by GTH and can be printed for your use and to share with your healthcare provider. At any time through the process of data entry, you are able to click on the Chart tab and GTH will produce your personal risk chart, which will delineate your risk of a cardiovascular event, such as a heart attack or stroke, at your present age and through the next 10, 20, and 30 years. The chart will divide the risk due to the family history, which is the non-modifiable risk, and the risk due to your own health and lifestyle history, which is the modifiable risk. The chart will also define the general population risk for an average individual of your gender and age through the same time periods. At any time through the process of data entry, You are also able to click on the Report tab and observe your report, giving interpretations of the information entered up to that point. Obviously, both the risk charts and the report will be most useful when they take all information into consideration after you have finished the data entry.